All right, so today we have a patient that we want to get set up on E-Stim for muscle contraction because they're just after ACL surgery and they're having trouble getting their quadriceps muscles to contract. So that is our main indication to do E-Stim, is to get the muscles that are having a hard time to contract, to get them to contract, to strengthen them. Contraindications would be if they have any pacemakers, lack of sensation in the skin, or impaired cognitive abilities. So let's talk to the patient and get started. Hey Ryan.
Hi.
I'm Ryan.
Hi.
I'm a physical therapist, student physical therapist, under the direction of Dr. Sykes. And we're gonna hook you up on an E-Stim machine. Do you know what that is? Have you ever had it before?
A long time ago.
Okay, so it's a machine that's gonna just send some electrical impulses into your muscle here so that you can help it to get started firing, because we were seeing that you're having issues with that earlier, right? So we'll get it set up. First of all, do you have any lack of sensation in your leg down here?
No.
No?
Not really.
Okay. Do you have any cancer or pacemaker, anything like that that I should be aware of?
No.
Great. Cool. So if I could have you roll your shorts up a little bit, we will get this hooked up and ready to go. So once I do get it hooked up, I'll tell you what it should feel like. So for those of you watching at home, we're gonna set the machine up in biphasic, 10 to 30 duty cycle, so 10 seconds on, 30 seconds off, and get the rate should be between 50 to 80, so 60 is good, and width should be at least 200, so we'll start there. And then when we get started, we'll crank it up as high as the patient can tolerate. So we're gonna stick this right here on your quad. This lateral one was giving us some issues earlier, so we'll make sure we cover that one good. So when we get this started, I'm gonna start turning up the machine. You should feel it start to tingle first, and then that's not gonna help. If not, we'll use an alcohol pad. But you should feel it start to tingle, and then after it's done tingling, good idea. There we go. Great. So you should feel a light tingle, just like ants dancing on your leg, and then it will increase in strength, and then your muscle will actually start contracting. We want you to be able to tolerate it. We don't want it to hurt, but as high as you can have it go while your muscle is contracting without feeling a lot of pain. That's what we'll go to. That's our goal. Okay. So I'm gonna start cranking that up. When you start feeling the tingling, let me know.
Right.
Tingling starting.
Mm-hmm.
Okay. So let's watch for muscle contraction, and as it's getting close to being your limit, let me know. They're starting. How are you feeling?
Pretty good.
Okay. Still okay? It's getting pretty strong.
Feels not too bad.
Not too bad yet. Okay.
You're right about close to there.
Close to there is good.
Yeah.
Okay.
That works.
Yep, that'll be great. So we'll start it. It'll have you hold this for 10 seconds. Then it'll turn off for 30 seconds, and then it'll hit you again. Okay. So this is really so that we can get that muscle stronger right now while you have your ACL repairing. We want to make sure these muscles stay strong so that when we're getting into moving, your muscles aren't weak, because that'll just make rehab that much harder. Okay. Do you have any questions?
No.
There should come another one in the next couple seconds.
I'm anticipating. There it is.
You doing all right?
Yeah, I'm good.
Okay. It's good contraction. All right. Turn that off. So that felt good for you?
Yep.
We would have done that for at least 10 to 20 good, strong contractions in a real scenario. Muscles would have fatigued. That's the goal. So You're still feeling fine. Skin looks good. All right. Sounds good.